Yo guys, what's up? MLG Gaming here. Today we're gonna play Surgery Squad. And it's a fun little surgery game. So today we're gonna do braces. And if you want to play this game, you just have to have Google, you have to have Abdo Flash Player. It's a good game though. I totally recommend it. I have it and I totally recommend it. So,
welcome to Surgery Squad. I'm Dr. Jeff, and today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth.
They do.
Let's face it, most of us do not have perfect teeth. Everyone's smile is unique.
I do.
Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite.
Yeah.
If your lower jaw is bigger than your upper jaw, you have an underbite.
I have overbite.
Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Which was? Oh, I like when this happens. It's fun. Like when you go to the dentist and they do the x-ray. Beep. Take it out.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake.
Cool.
Can you put the mold in the mouth?
Yeah, I can put the mold in the mouth. There you go. Eat that.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall.
Okay.
We'll arrange an appointment for next week to put the braces in place.
Okay. 1 week later. Jams. This is a good jam.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth.
Nasty.
Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Yay. Just so I'm done.
Wow, what a marvelous job. I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth.
Hook?
Slip the molar band over the tooth. We'll cement it into place later.
Oh, cement? Seriously, why? It's a mouth, not a construction site.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I'll run the suction to remove the water.
Okay. Gonna drown her. There we go. Oh, I'm done. Good sound effects.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
Yeah, because that's why I dry the teeth. Oh, it's nice and dry.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
A little bonder, just click. There you go.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Click. click, click, click. Snapple, pie, crackle, dackle. On my shackle, snapple, dapple, dabble, dabs, tackle, water dip.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Okay.
Great job! Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
Oh, it's some bands that are just arch enemies. Because they have some arch enemies and they're just bands.
Good job! We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place.
Cool.
Now we'll use the elastic ligatures to make sure the arch wire does not fall out of the band.
Elastic ligatures?
The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers.
Cool.
Now you try. Place the ligature over the brackets indicated. And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist.
Okay.
It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here?
We're still gonna do dental filling. Dental stuff. In the next video, probably laparoscopic gallbladder surgery. Actually, I'm doing teeth
Welcome
whitening.
to...
I'll do the laparoscopic stuff. Actually, no. Yeah, laparoscopic gallbladder surgery and tumor-assisted liposuction. Tumor-assisted liposuction. I don't know. No, I'm not gonna hit the enemy because it's gonna fail me now. Yeah, it's when I like to hit the enemy. Pew, I did it. Pew, pew, pew. Pow.
Hello,
Pow.
and welcome to Surgery Squad's virtual teeth whitening. I'm Dr. Susie, and I'll be guiding you through this procedure today. You no longer have to be a supermodel or a movie star to have a dazzling white smile. Just about anyone nowadays can get one. A whiter smile looks healthy. Plus, it can improve your overall appearance and self-confidence.
I hit the mic with my hand.
Our teeth become stained from coffee, tea, and other dark-colored liquids, and smoking certainly adds to the discoloration. A teeth whitening procedure can remove those stains caused by age and the things that we eat and drink. There are a variety of ways to do it. A whitening toothpaste or rinse, over-the-counter strips and gels, tray-based whiteners, or in-office whitening performed by a dentist. While the most obvious benefit is a brighter, whiter smile, you do need to know that whitening is not permanent, and a whitening program, whether you do it yourself or have it done by a dentist, might not always lead to the results you want. If you have the whitening performed by a dentist, your teeth need to be in pretty good condition. Your dentist will also want to fill any cavities or replace older fillings before the procedure. In addition, a dentist will not perform the procedure if you have gum disease or your teeth have worn enamel. If you already have crowns or other restorations, the whitening will be inconsistent between those teeth and the others. Our patient today is a 27-year-old woman who has opted for an in-office dental whitening. She's a tremendous admirer of coffee, but she wants to impress the folks at her 10-year class reunion with a bright, white smile. So let's scrub up, glove up, and help her out. Our hygienist has already cleaned her teeth to remove all of the plaque. So let's start by matching our patient's current tooth shade with one from our shade reference guide.
That one? That one? That one?
Okay, we've got our starting shade. Let's see if we can make them more like this. First, protect her lips and tongue by covering them with these rubber guards. Nice work! Now we need to cover her gums and papilla, which are the tips of her gums between her teeth, with a special coating to protect them from the risk of chemical burns when we use the bleaching agent.
And the bottom? Aww. It takes forever. Okay, fine. Fine. I'll do it for the video. Yay! I get to do that, and I get to do that. There.
Now, let's mix up our bleaching agent. We'll use carbamide peroxide, which is a powerful, reddish-looking substance. It turns into a stronger form of hydrogen peroxide in the mouth once we clean it off with water. That's when it takes off the stains. The mixture is ready, so let's get it onto her teeth. Cover each tooth evenly.
Okay. Peroxide. Blood red peroxide. Squish, squish.
We keep this solution on her teeth for about a half an hour.
Half an hour.
Let's see what kind of beautiful smiles underneath all of this red stuff. Take some water and gently wash away the carbamide peroxide.
Okay. Nice. Nice white smile. Bleached it. And wash off it all. Get the tippies and the top and the sides. And all the back. And there.
Now with our dental pick, simply pop the protective coating from her gums.
Okay. What the heck? The sound it makes is not something I want to hear. Oh, that sounded really squishy. It would not make that type of sound.
Great work! I'll take off the rubber lip and tongue protectors and see you back out in the waiting room. She's really gonna knock 'em dead with that bright smile of hers at her class reunion. But for now, her teeth will probably be sensitive for a few days. She should avoid extremely hot or cold beverages for the rest of the day and use a toothpaste made for sensitive teeth for a couple of weeks. She should also, as much as possible, avoid discoloring beverages like coffee, colas, or red wine for a few days.
Red wine,
If she smokes, well, now would be a perfect time to stop. This bleaching will most likely last for 2 or 3 years, so she'll want to make this an ongoing part of her overall dental care. She should call her dentist if she feels a burning sensation in her gums or on her teeth that lasts for a couple of days, or if her teeth remain highly sensitive. You did a fantastic job today.
So
while you're here, try your hand at one of our other
Goodbye.
surgeries.